Hi and welcome to Herida Healthcare Moving and Handling Limited. We've created a range of videos which are used to support instruction of how to best apply each sling type. Our videos are to be used as a guide only, so please note that a full assessment must be taken by a qualified carer in every instance prior to a lift. First, a thorough inspection of the sling, binding and webbing must take place. If it's worn, torn or ripped in any way, then please discard and do not use the sling. Equally, make sure that you're aware that the sling and hoist demonstrate the maximum user weight clearly, and also that you are aware that the patient you are about to lift fits comfortably within the maximum weight limitations. The sling must also have an individual serial number that allows traceability for its model and design. Slings with loop attachments must be applied to hook-type spreader bars with loop configuration, and slings with clips must be applied to peg or clip-type spreader bars with clip configuration. Never use either design on a non-configurable spreader bar. It can often be intimidating being hoisted for the first time. Therefore, always clearly communicate your lifting intentions whilst providing reassurance both beforehand and throughout the lifting process to your patient. The patient and sling hoist falls into the regulations of LOLA, or lifting operations and lifting equipment, and PURE, provision and use of work and equipment regulations, and must be treated as such. For further information, please visit the HSE website at hse.gov.uk. The Ouse hammock sling, or more commonly referred to as an in-situ sling, is normally used for those patients who require a greater level of support or who have complex needs. As such, the cut and design are made in such a way that the product can only be initially applied from a lying position, from the bed or floor to a chair. Therefore, after initial application, the Ouse hammock sling can be used to transfer from a seated to seated position without removal. However, for the purpose of tissue viability considerations, slings should only be left in situ during extreme circumstances. It is also recommended that this type of sling is made from a pressure-reducing spacer-type material. Always raise the bed to waist height to minimise stress on the carer's back prior to lifting. Ask the patient to roll onto their side if they're capable of doing so. If the patient needs assistance to roll, this should be done at the shoulder and hip areas. As the patient is placed on the side, roll one half of the sling and tuck gently onto the centre of the back and buttocks as shown, taking care not to pinch the skin. Lay out the remaining sling in readiness for the next process. Roll the patient over onto the other side of their hip and unroll the sling so that it's fully open and interfacing the floor, surface or bed. Assist the patient where necessary. Place the patient carefully on their back and gently pull out any creasing. Ensure this sling is kept central, as the patient may be in situ for some time. The ideal position for the patient's hands is for them to be placed by their stomach or by their side during this process. If the patient is on the floor, lower the spreader bar and open the legs of the hoist around the patient's head. If your patient's in bed, the legs of the hoist should be placed underneath the bed. Place the leg support sections underneath the legs and feed the straps through the dignity hoop before applying the straps to the spreader bar. Apply the head section parts also to the bar using matching loop or clip colours. This process should be followed unless the patient's clinical condition dictates otherwise. Raise the spreader bar gently, ensuring that no nipping or pain is transferred to the patient. Regular communication and reassurance should be provided to your patient throughout the process. The spreader bar or strapping, if selected, on the rear of the sling can be used to steady the patient during the lift. A full risk and safety assessment should always be conducted with the patient and surroundings prior to any lift. Do not attempt to lift any patient during any circumstances without the appropriate training. Moving and handling vulnerable patients is a serious business, and Herida do not endorse unsafe or underqualified staff throughout any lifting process. If you're unsure, please contact a supervisor or line manager within your workplace who will be responsible for the correct procedural lift and training policies within your site.